Hello everyone, my name is Dan, I'm your host again. So welcome to the new episode of our Top Talks. And today we have Dr. Mostafa. So could you do a brief introduction for yourself? Because I know you have so many fans already.
Thank you so much for that. Hello everyone, this is Mostafa Anwar. I'm a micro-endodontist from Egypt. I have been practicing for more than 16 years now. My practice is only limited to micro-endodontics and restorative dentistry. I have been teaching for more than 15 years. I'm in love with endodontics. I have been traveling all around to teach endodontics, and I have lots of continuous education programs worldwide. I have been to more than 30 countries worldwide.
Wow.
So I believe I have the passion for endodontics. This is simply me.
Okay, thank you. Yeah, it's really good to have you, to meet you in person, because I always see you in my social media. Right?
That's my pleasure.
Okay.
That's my pleasure.
Yeah, so could you share a little bit about your journey with Woodpecker products? So have you using our products, or what kind of products are you using right now?
It's a very long journey.
Okay.
I have been using Woodpecker's products for more than 7 years now.
Wow.
Yeah.
70 years is almost the time we launched our endomotor or something like that.
Exactly. And our first meeting was in 2018 and 2019.
Okay.
And since then, it's only Woodpecker.
Wow.
And I have been using lots of products for Woodpecker, like U600,
okay.
UCAI endomotor, EndoPace, the black edition from KMC,
yes,
from Egypt. And actually, since then, these are my warriors,
Okay. So you keep using, yeah, right.
Yes, exactly.
Yeah. And also I know, because say maybe from the 7 years ago is almost the time that we launched the first endomotor. The first endomotor was launched in 2017.
Yes.
Back to that day. So during this maybe period, so did you see some improvement of the products, or how you see, are we making better
actually,
products?
If you said some improvement, this is just an underestimation.
Okay.
Because it's much more improvement.
Much more improvement.
Much more improvement, yeah,
Okay.
yeah. And actually, I believe Woodpecker, has already elevated the level of technology when we come to endodontics.
Yes.
And actually releasing all this technology to all the dentists worldwide, this is a very good thing. Because, before that, technology was a little bit limited.
Yes.
And it was already some sort of being kept in order to, you know what I mean.
Yeah.
But nowadays, no, the technology is everywhere. Everyone is using the Woodpecker products. Everyone is happy. The technology is everywhere. And even already, I believe that Woodpecker has already made the competition so hard for the other companies.
Okay.
And especially when you're releasing new technologies every day, and when you have a very good R&D team. So this keeps more promising for us as dentists.
Yes.
And at the same time, this helps us as dentists worldwide, as endodontists.
Yes.
And of course, you're helping the new generation. I remember 15 years ago when we were doing root canal treatment, we didn't have all that technology. But nowadays, with all that technology and all that new modifications that we have in our devices, it can help all the new generation very much better than us.
Yeah, I fully agree with you, because I just talked with the professor from MIU. So he's mentioned that they're using Woodpecker equipment as the teaching equipment right now.
Exactly.
Yeah, so I think that's how we can maybe influence a little bit about the younger generation of dentists, right?
Exactly. But one more thing, even the software, it's very user-friendly.
Okay.
So teaching it to new generations, this makes it more simpler and more user-friendly, and even the dentists like it so much because you can just adjust it whatever you like, and you can just use it immediately.
So you're talking about the software for the endomotor, or?
Yes, mainly for the endomotors.
And mainly for the endomotors.
Mainly for the endomotors, yes.
Okay.
Yeah.
So it's
even the apex locators and whatever.
Gotcha.
Yeah.
Okay. That is really good. So what would you think is the most or the best technology you like from us?
For the best technology?
Like from us.
This is a very tough question, because you have lots of technology that you're already releasing. But if for me to choose, I will go for the UCAI endomotor. Okay. Yeah, for the T-mode, for the ledge bypass and broken file bypass. I guess this is one of it. When it was released, it was very promising, and actually, I believe everyone has got the sensation that he can get the benefit for actually dealing with complex endodontic scenarios much more easier with that technology. So yes, I believe this is one of the best.
Okay. Yeah. Okay, good. And also talking maybe back to the course we are making today, because today we are doing another course with Dr. Yang from Temple University.
Yes.
So from his lecture, he's also mentioning about root resorption. So what is your opinion on this?
It's a very interesting topic, actually. And I believe what he's talking about today, it's one of the most difficult and complicated cases already. Yes,
yeah,
and it's
yeah.
one of the most difficult topics
Okay.
to be addressing already. And it was a very interesting lecture. And yes, we have many cases of resorption that we can face, and especially
Yes.
dental traumas.
Yes.
So I believe his lecture was very interesting, and everyone could benefit from it. And you
Yeah.
can see already at the lecture hall,
Yeah.
everyone was just taking photos, and
Right.
everyone, because it was very interesting lecture.
Yeah, and for this part, what you see could be maybe the biggest challenging for you, or the most difficult part for
The most challenging
dealing with-
is
yeah.
patient satisfaction and prognosis.
Okay.
This is the most difficult thing, because in dental trauma cases or
Yes.
resorption cases, you cannot satisfy the patient because already you don't know what's the prognosis.
Correct.
You can predict,
Yes.
but you don't have an accurate prediction for that.
Gotcha.
And sometimes you can say, yeah, we are going to do our best in order to save the tooth, but it's out of our hands, so we
Okay.
cannot do it.
Yeah.
So this is the most challenging part,
Okay.
dealing with the patient satisfaction, because sometimes he comes with very high expectations,
exactly.
and he wants to save the tooth no matter what, but it's totally out of your hands.
I
And
see.
sometimes they come in a late stage, where the only treatment option is extraction of the tooth.
Right.
So you cannot do anything.
I see. So you think maybe and also there's maybe how you negotiate with the patient is also very difficult.
Yes.
Part, yeah.
Including the patient in the treatment plan, this is one of the most important things.
I see.
Yes.
So
He
it's
should be a
always-
part of the treatment plan. His opinion matters a lot.
Yeah, it's always like patient oriented, right? You have to deal with the
And
patient.
I always say that the patient-doctor relationship, it's not only about giving you the treatment that you need, but
Okay.
it's much more beyond than that.
Okay.
Satisfaction, it's confidence between us, it's trust between us.
Yeah.
So there are lots of emotional things that you have to deal with the patient
Yeah.
before only giving your treatment.
I see. I can really feel that why you have so many fans, because you're really taking care of. You set a good example how
Thank you so much for
negotiate with the patient, right?
Thank you so much for that.
Yeah, and how you see today, but today we're also talking about the regenerative endodontics. So how you see maybe the potential of this one?
The potential is really nice, and actually we have been talking about regeneration for many years now.
Yeah.
And there is already some sort of advances in the stem cells and stuff like this. However, I guess we need more years and more research in order to be implementing this technology and implementing all these studies in our daily practice.
Right.
So it's still in the research phase. I believe we need more research about that. But actually for regeneration, yes, we are doing some cases in our practice.
Yes.
And regenerative endodontics, according to the American Association of Endodontists,
Okay.
it can have success rate above 90%.
Okay.
If you can follow the exact protocol and if you can choose the cases wisely. So yes, it's a very good thing to do.
Wow. So how often you're doing this kind of procedure?
It depends on the pediatric dentist in my practice, because he's the one referring to me.
Yeah.
But I'm not saying it's a lot of cases. But let's say, for example, like every 2-3 months, I can deal with 3 to 4 cases.
I see.
for
I see.
regeneration. Yeah.
Okay. Yeah, and also because today, because now you are in our factory, maybe we are gonna also show you maybe some of our facility. So after maybe visiting all the facilities, so do you have any suggestion to us, or maybe especially for the product development?
Let me tell you one thing. I have been already to visit this facility before, and I have taken a very huge tour in September 2023.
September. Okay.
Yes, 2 years ago.
2 years ago.
And I believe the Woodpecker score is about efficiency, durability, and technology.
Okay.
So these 3 words can simply explain what Woodpecker is trying to do.
Right.
Yeah, efficiency, durability, and technology, and paying so much attention to the research and development. So this is really nice.
Yeah.
And you are already changing the world of dentistry worldwide.
Yeah.
So keep it up, and always pay attention to the quality of the products.
Wow.
You have already very good quality. I remember there was 2 years ago, if I can remember actually, but there was even a drop test, because you need to drop test, because you need to be sure that the shipment, when it's going to go for many days in order to reach another country,
exactly,
you have to be sure that even with any drop or any mishandling for the box or something like this, it's still the same and everything is perfectly organized inside.
Right.
So no, you care about the quality, just keep it up. And you have changed the face of dentistry already.
Thank you. Yeah, for the job test, or actually we have more tests over there.
Yeah, so, I know, but I cannot talk about it.
Right. Okay. Yeah, and then maybe because you have so many fans, so could you say something to your audience, like what you see is the most important part for you to select some equipment site? Yeah.
I will always go with a durable equipment.
Okay.
Having a user-friendly interface.
User-friendly interface first.
And durable.
Durable.
Of course.
Yeah.
You don't need to throw or waste your money away.
Okay.
And efficient product. It can do the job,
okay.
and it can stay up in your hands. I will tell you a funny story.
Okay.
I will tell you a funny story about that. When I got my AI endomotor from Woodpecker.
Yes.
And it was in 2019.
Okay.
So I have been using it for about 3 or 4 years.
Okay.
Okay. So in 2022 or 2023.
Yeah.
Actually, I got some clicking sound in the handpiece.
Okay.
So I was wondering why I have some clicking sound.
Right.
So I asked the team of Woodpecker, okay. I have some clicking sound, so can you tell me why? So he said, okay, doctor, are you following the instructions for oiling and everything? Mm-hmm. So I said, I don't know. I asked my nurse. Yeah. I asked the nurse, and for 4 years, she didn't even put a drop of oil into the handpiece. Okay. And the handpiece is working perfectly for 4 years without any drop of oil. Wow. Of course, it's something like, it's a big mistake for my nurse. Yeah. However, but this can tell you about the quality of the product. Yes, yes. 4 years, the handpiece is just going every day, doing root canal treatment. Okay. Okay, for about 5 to 6 hours. And at the end, after 4 years, there's some clicking sound. Yeah, yeah. No, thank you for that. Yeah. Thanks to Woodpecker for that. Okay. This is a really good example how we think that always quality first. You see that slogan from us. Exactly. Yeah. And also for choosing the products, like Dr. says, and also you can always trust Woodpecker, right? You can't always trust Woodpecker. Yeah. You know, like this is something that can go blindly. Okay. Trusting Woodpecker, you can do it in any product. I'm not talking about endodontics. Okay. In any product. Yeah. Yeah. Okay. Okay. Yeah, I think maybe that's all about the interview today. Thanks for coming again. It's quite a pleasure to always be with you. Thank you. Thank you. Thank you so much, Stan. Okay.